Stop sleeping like that. If you're over 60, this is not about comfort anymore. It's about silent damage. You may not feel it. That's the problem. The strain builds slowly. Night after night. Reduced oxygen, increased pressure, subtle nerve compression. By the time the stiffness, memory lapses, irregular heartbeat, or chronic fatigue show up, the underlying damage may already be years in motion. After 60, arteries stiffen, discs thin, muscles weaken, airways narrow more easily. A sleep position that felt harmless at 40 can become dangerous at 70. A large study published in the Journal of Clinical Sleep Medicine, tracking over 10,000 older adults for nearly a decade, found that certain sleep positions were associated with up to a 29% increase in nighttime cardiovascular stress markers in seniors. 29%. From posture alone. Researchers at Stony Brook University also found that compromised sleep positioning reduced nocturnal cerebral oxygenation in older adults, contributing to measurable increases in long-term cognitive decline risk. Now, before you panic, relax. The solution is simple, free, no medication, no special equipment required. Tonight, I'll walk you through the 4 worst sleep positions for seniors over 60, and then the 4 best positions that actively protect your heart, brain, spine, and longevity. Stay with me, because the final best position is associated with over a 30% difference in cardiovascular mortality risk in high-risk seniors. Before we begin, comment your age and where you're watching from. I read every comment, and it helps others over 60 realize they're not alone. Let's start with the 4 worst. Number 4, worst. Sleeping completely flat on your back with no elevation. Millions of seniors do this. It feels neutral. When you were younger, your airway tone was stronger and your circulation more resilient. After 60, lying fully flat increases airway collapse and venous pooling. A review in Sleep Medicine Reviews, analyzing more than 6,000 older adults, found supine flat positioning increased apnea events by up to 38% in seniors. 38%. When breathing partially obstructs, oxygen drops. The heart compensates. Blood pressure fluctuates. Over time, that increases cardiovascular strain and inflammatory stress. It also increases nighttime sympathetic nervous system activation, meaning your body remains in a low-grade stress response for hours. That repeated oxygen instability can impair deep sleep cycles, reduce growth hormone release, and limit overnight tissue repair, accelerating fatigue, stiffness, and vascular aging. Number 3, worst. Tight fetal position with deep spinal flexion. Curling tightly may feel safe, but extreme flexion compresses discs and narrows nerve channels. The Spine Journal published data following over 4,000 adults over 65 showing prolonged excessive spinal flexion during sleep correlated with a 22% higher report of chronic morning back and nerve pain over 5 years. Hours of flexion push discs backward and decrease paraspinal muscle circulation. That increases stiffness, nerve irritation, and mobility decline risk. Over time, reduced circulation around the spine limits oxygen delivery to stabilizing muscles, allowing weakness and imbalance to develop. Hip joints remain in prolonged flexion, tightening surrounding ligaments and shortening hip flexors. This can alter walking mechanics, reduce stride length, and increase fall risk. What feels protective at night may quietly be compromising your independence during the day. If this is already changing the way you think about your sleep, take 1 second right now and like this video. It tells me you want more research-based senior health guidance like this, and it helps this information reach more adults over 60 who may be sleeping in positions that quietly strain their spine and nerves every single night. Small action, big impact. Number 2, worst. Stomach sleeping. This position rotates the neck up to 70 to 80 degrees for hours and flattens the natural lumbar curve. The American Journal of Respiratory and Critical Care Medicine analyzed over 5,000 older adults and found prone sleeping reduced oxygen stability overnight and increased inflammatory markers by approximately 18% in seniors. Reduced oxygen plus inflammation increases vascular stiffness and cognitive strain over time, but the mechanical stress is just as concerning. When the neck stays rotated for 6 to 8 hours, small facet joints in the cervical spine absorb continuous asymmetric pressure. Blood flow through vertebral arteries may be mildly compromised in vulnerable individuals. The lower back, forced into extension without support, experiences ligament strain and uneven disc loading. Over years, this can accelerate degenerative changes, contribute to chronic neck pain, tension headaches, shoulder numbness, and even balance instability. After 60, recovery capacity is slower. What your spine tolerated decades ago becomes cumulative structural stress now. Number 1. Worst. If you change only one thing, let it be this: sleeping flat on your back while snoring heavily, or experiencing breathing pauses without elevation or side support. The New England Journal of Medicine reported untreated obstructive sleep apnea in older adults was associated with a 33% increase in cardiovascular mortality. 33%. JAMA further linked recurrent nighttime oxygen drops with increased stroke and dementia risk in seniors. When you lie flat and your airway collapses repeatedly, oxygen falls, stress hormones surge, blood pressure spikes. Over years, this significantly increases heart disease, stroke, and mortality risk. And here's what makes it more dangerous after 60. Aging tissues lose tone. The tongue and soft palate collapse more easily. Fat distribution around the neck increases airway narrowing. Each oxygen drop triggers micro-awakenings that you may never remember, but your heart does, your brain does. Repeated hypoxia promotes plaque instability inside arteries and increases atrial fibrillation risk. Night after night, this creates a silent cycle of oxygen deprivation and cardiovascular strain that accelerates biological aging. That is the peak danger. Now let's shift to protection. Here are the 4 best positions for seniors over 60. Number 4, best. Slightly elevated back, sleeping with knee support. Instead of flat, elevate your upper body 10 to 20 degrees using a wedge pillow or adjustable base. Place a pillow under your knees to reduce lumbar strain. This reduces airway collapse, improves venous return, and lowers nighttime blood pressure fluctuations. Even small elevation has been shown to reduce apnea severity in positional cases by double-digit percentages. Elevation also decreases gravitational pressure on the diaphragm, allowing fuller lung expansion with each breath. When the knees are slightly bent, the pelvis tilts into a more neutral position, reducing shear force on lumbar discs. That means less overnight joint compression and less morning stiffness. For maximum benefit, keep your chin slightly tucked, not extended backward. Use a supportive pillow that fills the space between your neck and shoulders without pushing your head forward. Small adjustments in angle can dramatically improve airflow efficiency and spinal alignment after 60. Number 3, best. Neutral side sleeping with spinal alignment. Sleep on your side with a pillow between your knees. Keep your spine straight, not curled. Keep shoulders stacked. This reduces disc compression, maintains nerve spacing, and improves circulation through paraspinal muscles. It also decreases mechanical stress on hips and lower back. For maximum benefit, use a medium-firm mattress that prevents hip sagging. In this position, the spine maintains its natural curves, allowing intervertebral discs to rehydrate overnight. When discs rehydrate properly, they absorb shock more effectively the next day, protecting mobility. Keeping the knees separated prevents internal hip rotation, which reduces strain on the sacroiliac joints. Make sure your pillow height matches the width of your shoulder so your head stays level, not tilted downward. For added stability, lightly hug a small pillow to prevent your top shoulder from collapsing forward. This small adjustment can significantly reduce morning stiffness and improve spinal longevity after 60. If you know someone over 60 who wakes up stiff, sore, or exhausted every morning, share this video with them right now. One simple positioning change tonight could protect their spine, their breathing, and even their long-term heart health. Sometimes the most powerful help you can give isn't complicated. It's just passing along the right information at the right time. Number 2. Best. Left side supported positioning. Sleeping on the left side can enhance lymphatic drainage and reduce nighttime reflux, which improves sleep stability. Use a full-length body pillow to prevent rolling forward. Slightly bend knees without compressing them. Keep neck neutral with a supportive pillow matching shoulder width. This position supports diaphragmatic breathing and stabilizes oxygen levels more effectively than prone or flat supine positions in many seniors. There is also a circulatory advantage. The heart naturally sits slightly left in the chest cavity, and left side positioning can reduce pressure on major blood vessels compared to certain right side or flat positions in susceptible individuals. For seniors with mild reflux or nighttime coughing, gravity helps keep stomach contents lower, reducing micro-awakenings. To optimize this posture, place a small pillow behind your back so you don't roll onto your back unconsciously. Keep hips stacked vertically and avoid twisting your torso. Consistency matters. Maintaining this alignment nightly can significantly improve breathing efficiency and restorative sleep quality after 60. If you value clear, research-backed guidance designed specifically for adults over 60, subscribe to Senior Health Support right now. This channel is dedicated to protecting your mobility, heart health, brain function, and independence with practical strategies you can apply immediately. No hype, no extremes, just evidence-based senior health support. Subscribe and take control of your health after 60. Number 1. Best. If you adopt only one protective habit, make it this. Strategic airway protective positioning with head elevation and side stabilization if you snore or have apnea risk. Elevate the head 15 to 30 degrees. Sleep on your side if snoring is present. Keep the chin slightly tucked, not extended. If symptoms persist, request a home sleep study from your physician. Positional therapy alone has been shown in multiple clinical trials to significantly reduce apnea severity in selected patients, lowering nighttime oxygen drops and stabilizing heart rhythm. Stabilizing oxygen protects the brain, protects the heart, protects longevity. And here is why this matters so much after 60. Even mild repeated oxygen dips can impair memory consolidation and increase morning blood pressure variability. When oxygen remains stable through the night, the heart does not need to repeatedly surge to compensate. That reduces strain on arterial walls and lowers long-term vascular stress. For maximum benefit, combine elevation with consistent side support so you do not roll flat during deep sleep. Track snoring patterns or nighttime awakenings. Small, deliberate positioning changes can produce measurable improvements in oxygen stability within weeks. Let's reinforce clearly. Avoid flat back sleeping. Avoid tight fetal curling. Avoid stomach sleeping. Avoid flat supine snoring without support. Instead, elevate slightly. Align your spine. Use supported left side positioning. Protect your airway. These changes are free. No medication, no side effects. Research-backed. Pick one tonight. Practice it for 2 weeks. You may notice less stiffness, steadier energy, deeper sleep, clearer thinking. Always consult your physician if you have diagnosed sleep disorders or cardiovascular conditions. Now tell me, Which of the worst positions are you currently using? And which best position will you try tonight? If tonight's sleep position can silently strain your heart and brain, imagine what your morning coffee might be doing. Because after 60, it's not just how you sleep that matters. It's what you put into your body within the first 30 minutes of waking up. Some popular coffees increase inflammation, spike blood pressure, and disrupt circulation. Others can actually support metabolism, vascular health, and cognitive clarity. In my next video, Seniors Over 60, 4 Worst Coffees and 4 Best Daily Picks, I break down exactly which types quietly stress your cardiovascular system, and which ones may help protect your heart and energy levels instead. One of the worst options is consumed daily by millions of seniors, and one of the best choices has been linked to measurable improvements in metabolic markers in older adults. If you care about protecting your heart, brain, and longevity after 60, watch that video next. Your nights matter, but your mornings might matter even more.